A hospital, a healthcare institution providing patient treatment with specialized health science and auxiliary healthcare staff and medical equipment. The best known type of hospital is the general hospital, which typically has an emergency department to treat urgent health problems ranging from fire and accident victims to a sudden illness. A district hospital typically is the major healthcare facility in its region, with many beds for intensive care and additional beds for patients who need long-term care. Specialized hospitals include trauma centers, rehabilitation hospitals, children's hospitals, geriatric hospitals, and hospitals for specific medical needs, such as psychiatric hospitals for psychiatric treatment and other disease-specific categories. Specialized hospitals can help reduce healthcare costs compared to general hospitals. Hospitals are classified as general, specialty, or government depending on the sources of income received. A teaching hospital campus combines patient care with teaching to health science students, auxiliary healthcare students, and qualified medical graduates completing their postgraduate residencies before licensure to practice. A health science facility smaller than a hospital is generally called a clinic. Hospitals have a range of departments, e.g. surgery and urgent care, and specialist units such as cardiology. Some hospitals have outpatient departments and some have chronic treatment units. Common support units include a pharmacy, pathology, and radiology. Facilities that combine many healthcare functions, including general or specialized patient care, teaching, research, and so on, may use the term medical center. This term can also refer to an office complex with various unaffiliated health services or any kind of clinic or hospital. A large hospital or medical center also often serves as the administrative headquarters of a larger health system which may have multiple sites. Hospitals are typically funded by public funding, health organizations, for-profit or non-profit, health insurance companies, or charities, including direct charitable donations. Historically, hospitals were often founded and funded by Christian religious orders, or by charitable individuals and leaders. Hospitals are currently staffed by professional physicians, surgeons, nurses, and allied health practitioners. In the past, however, this work was usually performed by the members of founding religious orders or by volunteers. However, there are various Catholic religious orders, such as the Alexians and the Bon Secours Sisters, that still focus on hospital ministry in the late 1990s, as well as several other Christian denominations, including the Evangelical Lutherans and Methodists, which run hospitals. 4 deaconesses have played a prominent role in healthcare. 5-6 In accordance with the original meaning of the word, hospitals were original places of hospitality, and this meaning is still preserved in the names of some institutions such as the Royal Hospital Chelsea, established in 1681 as a retirement and nursing home for veteran soldiers. Some patients go to a hospital just for diagnosis, treatment, or therapy and then leave, outpatients, without staying overnight, while others are admitted and stay overnight or for several days or weeks or months, inpatients. Hospitals are usually distinguished from other types of medical facilities by their ability to admit and care for inpatients, whilst the others, which are smaller, are often described as clinics. General Hospital redirects here. For the American soap opera, see General Hospital. For other uses, see General Hospital, disambiguation. The best known type of hospital is the General Hospital, also known as an acute care hospital. These facilities handle many kinds of disease and injury, and normally have an emergency department, sometimes known as accident and emergency, or trauma center, to deal with immediate and urgent threats to health. Larger cities may have several hospitals of varying sizes and facilities. Some hospitals, especially in the United States and Canada, have their own ambulance service. A district hospital typically is the major healthcare facility in its region, with large numbers of beds for intensive care, critical care, and long-term care. In California, district hospital refers specifically to a class of healthcare facility created shortly after World War II to address a shortage of hospital beds in many local communities. Even today, District hospitals are the sole public hospitals in 19 of California's counties and are the sole locally accessible hospital within 9 additional counties in which one or more other hospitals are present at a substantial distance from a local community. 28 of California's rural hospitals and 20 of its critical access hospitals are district hospitals. They are formed by local municipalities, have boards that are individually elected by their local communities, and exist to serve local needs. They are a particularly important provider of health care to uninsured patients and patients with Medi-Cal, which is California's Medicaid program, serving low-income persons, some senior citizens, persons with disabilities, children in foster care, and pregnant women. In 2012, district hospitals provided $54 million in uncompensated care in California. A specialty hospital is primarily and exclusively dedicated to one or a few related medical specialties. Subtypes include rehabilitation hospitals, children's hospitals, seniors, geriatric hospitals, long-term acute care facilities, and hospitals for dealing with specific medical needs such as psychiatric problems, cancer treatment, certain disease categories such as cardiac, oncology, or orthopedic problems, and so forth. In Germany, specialized hospitals are called Fachkrankenhaus. An example is Fachkrankenhaus Coswig, thoracic surgery. In India, specialty hospitals are known as super-specialty hospitals and are distinguished from multi-specialty hospitals which are composed of several specialties. Specialized hospitals can help reduce healthcare costs compared to general hospitals. For example, Narayana Health's cardiac unit in Bangalore specializes in cardiac surgery and allows for a significantly greater number of patients. It has 3,000 beds and performs 3,000 pediatric cardiac operations annually, the largest number in the world for such a facility. Surgeons are paid on a fixed salary instead of per operation, thus when the number of procedures increases, the hospital is able to take advantage of economies of scale and reduce its cost per procedure. Each specialist may also become more efficient by working on one procedure like a production line. A teaching hospital delivers health care to patients as well as training to prospective medical professionals such as medical students and student nurses. It may be linked to a medical school or nursing school, and may be involved in medical research. Students may also observe clinical work in the hospital. Clinics generally provide only outpatient services, but some may have a few inpatient beds and a limited range of services that may otherwise be found in typical hospitals. Departments or wards. A hospital contains one or more wards that house hospital beds for inpatients. It may also have acute services such as an emergency department, operating theater, and intensive care unit, as well as a range of medical specialty departments. A well-equipped hospital may be classified as a trauma center. They may also have other services such as a hospital pharmacy, radiology, pathology, and medical laboratories. Some hospitals have outpatient departments such as behavioral health services, dentistry, and rehabilitation services. A hospital may also have a department of nursing, headed by a chief nursing officer or director of nursing. This department is responsible for the administration of professional nursing practice, research, and policy for the hospital. Many units have both a nursing and a medical director that serve as administrators for their respective disciplines within that unit. For example, within an intensive care nursery, a medical director is responsible for physicians and medical care, while the nursing manager is responsible for all the nurses and nursing care. Support units may include a medical records department, release of information department, technical support, clinical engineering, facilities management, plant operations, dining services, and security departments. Remote monitoring. The COVID-19 pandemic stimulated the development of virtual wards across the British NHS. Patients are managed at home, monitoring their own oxygen levels using an oxygen saturation probe if necessary and supported by telephone. West Hertfordshire Hospital's NHS Trust managed around 1,200 patients at home between March and June 2020 and planned to continue the system after COVID-19, initially for respiratory patients. Merseycare NHS Foundation Trust started a COVID oximetry at home service in April 2020. This enables them to monitor more than 5,000 patients a day in their own homes. The technology allows nurses, carers, or patients to record and monitor vital signs such as blood oxygen levels. In Europe, the medieval concept of Christian care evolved during the 16th and 17th centuries into a secular one. In England, after the dissolution of the monasteries in 1540 by King Henry VIII, the Church abruptly ceased to be the supporter of hospitals, and only by direct petition from the citizens of London were the hospitals St. Bartholomew's, St. Thomas's and St. Mary of Bethlehem's, Bedlam, endowed directly by the Crown. This was the first instance of secular support being provided for medical institutions. In 1682, Charles II founded the Royal Hospital Chelsea as a retirement home for old soldiers known as Chelsea pensioners, an instance of the use of the word hospital to mean an almshouse. 10 years later, Mary II founded the Royal Hospital for Seamen, Greenwich, with the same purpose. The voluntary hospital movement began in the early 18th century, with hospitals being founded in London by the 1720s, including Westminster Hospital, 1719, promoted by the private bank Sehore & Co. and Guy's Hospital, 1724, funded from the bequest of the wealthy merchant, Thomas Guy. Other hospitals sprang up in London and other British cities over the century, many paid for by private subscriptions. St. Bartholomew's in London was rebuilt from 1730 to 1759 and the London Hospital, Whitechapel, opened in 1752. These hospitals represented a turning point in the function of the institution. They began to evolve from being basic places of care for the sick to becoming centers of medical innovation and discovery and the principal place for the education and training of prospective practitioners. Some of the era's greatest surgeons and doctors worked and passed on their knowledge at the hospitals. They also changed from being mere homes of refuge to being complex institutions for the provision and advancement of medicine and care for sick. The Charite was founded in Berlin in 1710 by King Frederick I of Prussia as a response to an outbreak of plague. Voluntary hospitals also spread to colonial America. Bellevue Hospital in New York City opened in 1736, first as a workhouse and then later as a hospital. Pennsylvania Hospital in Philadelphia opened in 1752, New York Hospital, now Weill Cornell Medical Center in New York City opened in 1771, and Massachusetts General Hospital in Boston opened in 1811. When the Vienna General Hospital opened in 1784 as the world's largest hospital, physicians acquired a new facility that gradually developed into one of the most important research centers. Another Enlightenment-era charitable innovation was the dispensary. These would issue the poor with medicines free of charge. The London Dispensary opened its doors in 1696 as the first such clinic in the British Empire. The idea was slow to catch on until the 1770s, when many such organizations began to appear, including the Public Dispensary of Edinburgh, 1776, the Metropolitan Dispensary and Charitable Fund, 1779, and the Finsbury Dispensary, 1780. Dispensaries were also opened in New York 1771, Philadelphia 1786, and Boston 1796. The Royal Naval Hospital, Stonehouse, Plymouth, was a pioneer of hospital design in having pavilions to minimize the spread of infection. John Wesley visited in 1785, and commented, "I never saw anything of the kind so complete. Every part is so convenient, and so admirably neat. But there is nothing superfluous, and nothing purely ornamented, either within or without." This revolutionary design was made more widely known by John Howard, the philanthropist. In 1787 the French government sent two scholar administrators, Coulomb and Tenon, who had visited most of the hospitals in Europe. They were impressed and the pavilion design was copied in France and throughout Europe. A ward of the hospital at Scutari, where Florence Nightingale worked and helped to restructure the modern hospital. English physician Thomas Percival, 1740 to 1804, wrote a comprehensive system of medical conduct, medical ethics, or, a code of institutes and precepts, adapted to the professional conduct of physicians and surgeons, 1803, that set the standard for many textbooks. In the mid-19th century, hospitals and the medical profession became more professionalized, with the reorganization of hospital management along more bureaucratic and administrative lines. The Apothecaries Act 1815 made it compulsory for medical students to practice for at least half a year at a hospital as part of their training. Florence Nightingale pioneered the modern profession of nursing during the Crimean War when she set an example of compassion, commitment to patient care and diligent and thoughtful hospital administration. The first official nurses training program, the Nightingale School for Nurses, was opened in 1860, with the mission of training nurses to work in hospitals, to work with the poor and to teach. Nightingale was instrumental in reforming the nature of the hospital, by improving sanitation standards and changing the image of the hospital from a place the sick would go to die, to an institution devoted to recuperation and healing. She also emphasized the importance of statistical measurement for determining the success rate of a given intervention and pushed for administrative reform at hospitals. By the late 19th century, the modern hospital was beginning to take shape with the proliferation of a variety of public and private hospital systems. By the 1870s, hospitals had more than trebled their original average intake of 3,000 patients. In continental Europe, the new hospitals generally were built and run from public funds. The National Health Service, the principal provider of health care in the United Kingdom, was founded in 1948. During the 19th century, the Second Viennese Medical School emerged with the contributions of physicians such as Karl Freiherr von Rokitansky, Joseph Skoda, Ferdinand Ritter von Hebra, and Ignace Philipp Semmelweis. Basic medical science expanded and specialization advanced. Furthermore, the first dermatology, eye, as well as ear, nose, and throat clinics in the world were founded in Vienna, being considered as the birth of specialized medicine. By the late 19th and early 20th centuries, medical advancements such as anesthesia and sterile techniques that could make surgery less risky, and the availability of more advanced diagnostic devices such as X-rays, continued to make hospitals a more attractive option for treatment. Modern hospitals measure various efficiency metrics such as occupancy rates, the average length of stay, time to service, patient satisfaction, physician performance, patient readmission rate, inpatient mortality rate, and case mix index. In the United States, the number of hospitalizations grew to its peak in 1981 with 171 admissions per 1,000 Americans and 6,933 hospitals. This trend subsequently reversed, with the rate of hospitalization falling by more than 10% and the number of U.S. hospitals shrinking from 6,933 in 1981 to 5,534 in 2016. Occupancy rates also dropped from 77% in 1980 to 60% in 2013. Among the reasons for this are the increasing availability of more complex care elsewhere such as at home or the physician's offices, and also the less therapeutic and more life-threatening image of the hospitals in the eyes of the public. In the U.S., a patient may sleep in a hospital bed, but be considered outpatient and under observation if not formally admitted. In the U.S., inpatient stays are covered under Medicare Part A, but a hospital might keep a patient under observation which is only covered under Medicare Part B, and subjects the patient to additional co-insurance costs. In 2013, the Center for Medicare and Medicaid Services, CMS, introduced a two-midnight rule for inpatient admissions, intended to reduce an increasing number of long-term observation stays being used for reimbursement. This rule was later dropped in 2018. In 2016 and 2017, healthcare reform and a continued decline in admissions resulted in U.S. hospital-based healthcare systems performing poorly financially. Micro-hospitals, with bed capacities of between 8 and 50, are expanding in the United States. Similarly, freestanding emergency rooms, which transfer patients that require inpatient care to hospitals, were popularized in the 1970s and have since expanded rapidly across the United States. The Catholic Church is the largest non-government provider of healthcare services in the world. It has around 18,000 clinics, 16,000 homes for the elderly and those with special needs, and 5,500 hospitals, with 65% of them located in developing countries. In 2010, the Church's Pontifical Council for the Pastoral Care of Healthcare Workers said that the Church manages 26% of the world's healthcare facilities. Funding. Modern hospitals derive funding from a variety of sources. They may be funded by private payment and health insurance or public expenditure, charitable donations. In the United Kingdom, the National Health Service delivers health care to legal residents funded by the state free at the point of delivery, and emergency care free to anyone regardless of nationality or status. Due to the need for hospitals to prioritize their limited resources, there is a tendency in countries with such systems for waiting lists for non-crucial treatment, so those who can afford it may take out private health care to access treatment more quickly. In the United States, hospitals typically operate privately and in some cases on a for-profit basis, such as HCA Healthcare. The list of procedures and their prices are billed with a charge master. However, these prices may be lower for healthcare obtained within networks. Legislation requires hospitals to provide care to patients in life-threatening emergency situations regardless of the patient's ability to pay. Privately funded hospitals which admit uninsured patients in emergency situations incur direct financial losses, such as in the aftermath of Hurricane Katrina. Quality and safety. As the quality of healthcare has increasingly become an issue around the world, hospitals have increasingly had to pay serious attention to this matter. Independent external assessment of quality is one of the most powerful ways to assess this aspect of healthcare, and hospital accreditation is one means by which this is achieved. In many parts of the world such accreditation is sourced from other countries, a phenomenon known as international healthcare accreditation, by groups such as Accreditation Canada in Canada, the Joint Commission in the US, the Trent Accreditation Scheme in Great Britain, and the Haute Autorité de Santé, HAS, in France. In England, hospitals are monitored by the Care Quality Commission. In 2020, they turned their attention to hospital food standards after 7 patient deaths from listeria linked to prepackaged sandwiches and salads in 2019, saying nutrition and hydration is part of a patient's recovery. The World Health Organization reported in 2011 that being admitted to a hospital was far riskier than flying. Globally, the chance of a patient being subject to a treatment error in a hospital was about 10%, and the chance of death resulting from an error was about 1 in 300. 7% of hospitalized patients in developed countries, and 10% in developing countries, acquire at least one healthcare-associated infection. In the US, 1.7 million infections are acquired in hospital each year, leading to 100,000 deaths, figures much worse than in Europe where there were 4.5 million infections and 37,000 deaths. Architecture. Modern hospital buildings are designed to minimize the effort of medical personnel and the possibility of contamination while maximizing the efficiency of the whole system. Travel time for personnel within the hospital and the transportation of patients between units is facilitated and minimized. The building also should be built to accommodate heavy departments such as radiology and operating rooms, while space for special wiring, plumbing, and waste disposal must be allowed for in the design. However, many hospitals, even those considered modern, are the product of continual and often badly managed growth over decades or even centuries, with utilitarian new sections added on as needs and finances dictate. As a result, Dutch architectural historian Cor Wagenaar has called many hospitals built catastrophes, anonymous institutional complexes run by vast bureaucracies, and totally unfit for the purpose they have been designed for. They are hardly ever functional, and instead of making patients feel at home, they produce stress and anxiety. Some newer hospitals now try to re-establish design that takes the patient's psychological needs into account, such as providing more fresh air, better views, and more pleasant color schemes. These ideas harken back to the late 18th century, when the concept of providing fresh air and access to the healing powers of nature were first employed by hospital architects in improving their buildings. The research of British Medical Association is showing that good hospital design can reduce patients' recovery time. Exposure to daylight is effective in reducing depression. Single-sex accommodation help ensure that patients are treated in privacy and with dignity. Exposure to nature and hospital gardens is also important. Looking out windows improves patients' moods and reduces blood pressure and stress level. Open windows in patient rooms have also demonstrated some evidence of beneficial outcomes by improving airflow and increased microbial diversity. Eliminating long corridors can reduce nurses' fatigue and stress. Another ongoing major development is the change from a ward-based system, where patients are accommodated in communal rooms, separated by movable partitions, to one in which they are accommodated in individual rooms. The ward-based system has been described as very efficient, especially for the medical staff, but is considered to be more stressful for patients and detrimental to their privacy. A major constraint on providing all patients with their own rooms is, however, found in the higher cost of building and operating such a hospital. This causes some hospitals to charge for private rooms. Thank you for watching this video.